Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Federal government to receive 176,000 Johnson & Johnson COVID-19 vaccine next week. Experts at National Postgraduate Medical College of Nigeria call for more investments towards strengthening the nation's public health system to tackle COVID-19. And Kenya's public servants given 13 days to be vaccinated against COVID or face unspecified disciplinary measures. With more than 200 million cases of COVID-19 registered across the world, depending on the country, a new wave of the pandemic spurred by the more infectious Delta variants has limited efforts by governments across the world to ease restrictions and boost economic activities, which were grounded for most part of 2020. Poorer countries have also suffered a setback in their vaccination drive, with the efficacy of some vaccines less when it comes to the COVID-19 variant. Last night, 422 cases were recorded in Nigeria and 5 more deaths. This is coming as the Nigeria Center for Disease Control is calling on state governments and citizens to take more proactive steps to combat the outbreak of cholera across states in the country.
In response to the surge in daily COVID-19 cases, the NCDC is escalating its ongoing public communication efforts to reiterate COVID-19 guidelines and safety precautions for Nigerians to win the war against the disease. The numbers recorded in the last 24 hours have dropped from the figure reported earlier, as the NCDC announced 422 confirmed cases reported from 8 states and the FCT. Again, Lagos topped the chart with 190 cases, followed by Rivers, which reported 86 infections. Ogun came in third place with 85 infections. Oyo had 22 cases, while 20 cases were reported in the FCT. 7 cases were reported in Kwara. Edo registered 5 cases. Abia had 4, while Bayelsa registered 3 cases. There were 0 cases reported from Akwa Ibom, Ekiti, Kaduna, Kano, Nasarawa, Ondo, Osun, Plateau, and Sokoto states. The overall count of confirmed cases in Nigeria now stands at 178,508. There have been 219 discharges in the last 24 hours, increasing the total number of recoveries to 165,982. The NCDC also reported 5 additional deaths from COVID-19 causes in the last 24 hours, raising the fatality toll to 2,192. Presently, there are now more than 10,000 active cases in Nigeria, while over 2.5 million samples have been tested so far. In Africa, there are over 7 million confirmed cases and more than 178,000 deaths recorded across countries on the continent. The total global confirmed cases have now surpassed 203 million, while more than 4.2 million deaths have been reported.
The federal government is set to receive 176,000 doses of the Johnson & Johnson COVID-19 vaccine through the COVAX facility next week. The Executive Director, National Primary Healthcare Development Agency, told a news conference in Abuja that the federal government has committed 15% deposit for the 29 million doses of J&J vaccine expected this month. He debunks reports that the delay in the commencement of the second phase of the vaccination plan is owing to cases of documentation, but that the postponement became expedient in order to ensure the continuation of the tracking and tracing deployed during the previous rollout exercise.
As demand for COVID-19 vaccines climb in the global south, Nigeria is one of the countries racing to procure more of available vaccines. In addition to over 4 million doses of the Moderna vaccine received from the United States government, Nigeria expects fresh doses of Johnson & Johnson vaccine next week at the rate of $7.50 per dose.
We will be receiving 176,000 doses of the Johnson & Johnson vaccines tomorrow, Wednesday, August the 11th. These 176,000 doses, as you are aware, are coming out of the 29,850,000 doses that the federal government procured from the African Union It's a single dose vaccine that doesn't require a second dose. And for this Johnson & Johnson vaccine, the initial doses are going to be focused on those people that live in hard-to-reach areas. Every single dose of the Johnson & Johnson vaccine costs $7.50 per dose. So multiply that by 29,850,000, and that will give you the exact amount of money that we're expected to pay for it.
He debunks reports that the delay in the distribution of the Moderna vaccine is owing to issues of documentation.
On the contrary, the reason why we've had to extend or postpone the launch date of the vaccine is because we are locally creating labels for the vaccines, barcodes that will ensure that this tracking and tracing continues just like we did in the first phase.
In the coming months, Nigeria expects 3.5 million doses of Pfizer and an additional 3.9 million doses of the Oxford AstraZeneca vaccine.
Only less than. Well, Dr. Mohammed Kawu is the Acting Secretary, Health and Human Services Secretariat at the FCT. He joins us from our Abuja studios with more on vaccines. Thank you for joining us on the program.
Thank you. Good evening,
Doctor.
Yes.
Good evening. So J&J vaccines are expected, over 4 million Moderna vaccines waiting to be rolled out across the country. Let's look back at the 1% population vaccinated with the AstraZeneca, especially your station, the FCT. How satisfactory would you say was the previous rollout exercise?
Yeah, thank you very much. If you recall, FCT got over 230,000 doses. The first dose was given to about 130-something thousand. Unfortunately, those that had full vaccination, that received first and second dose, just dropped to about 100,000. But we exhausted all the vaccines sent to FCT. The challenge we had were those people that took first dose and for whatever reason, they did not come back to take the second dose. And but by and large, we are satisfied with what happened earlier. And I believe when we get to the second phase, we will also do our best in the circumstances. Thank you.
And you mentioned for those who failed to take the second dose, I mean, doesn't that point to vaccine wastage? Because now we hear that, you know, they can only wait until there's an AstraZeneca vaccine. They can't partake in Moderna or even J&J.
Yeah, I wouldn't call it vaccine wastage because, as you know, the first dose confers some immunity. And the second dose, that is called booster dose, confers full immunity. So even if you don't have full immunity, at least you have gotten some form of immunity. And for those that have taken the first dose and are awaiting the AstraZeneca to take the second dose, we await National Primary Healthcare Agency's directive on that. There are a lot of people that have taken the first dose and they are not able to take the second dose for whatever reason. So until we get a clear directive from the national, we are not likely going to do anything about it.
We know that the cold chain storage is very important, especially for the Pfizer-BioNTech and also Moderna vaccines. Who will be monitoring to ensure there is no wastage and that is when it is time to inoculate, so they're still potent?
Yeah, that is very, very important and very key. And based on that, the National Primary Care Agency donated ultra cold chain equipments to all the states of the Federation and FCT for the storage. And these vaccines, as you are aware, the ones that are coming are going to be stored under very, very high, very low temperature, minus 80 degrees centigrade. So in FCT, we have instituted a very, very good monitoring mechanism, and we already have M&E team working in the first phase that monitors deployment of the vaccines to the various area councils and how they utilize. The M&E team has been reinvigorated, and I will personally supervise the M&E, considering the fact that these vaccines, as you heard from the ED, National Primary Health Care, they are very costly and they are very, very important. So we will ensure that we monitor very well, and we only bring out the vaccines that will be utilized for that day because they needed to be maintained in a very, very conducive temperature. Thank you.
Finally, Dr. Kawu, I mean, vaccine hesitancy was rife then before we got the AstraZeneca vaccine. I mean, now we're having more and more. Would you say it's still the same? Does there need to be more sensitization, more awareness as to the COVID-19 vaccines?
Honestly, nobody will tell you there is serious vaccine hesitancy across the globe generally, not only Nigeria. But in our case, I think it's more serious. However, with a lot of sensitization, a lot of risk communication, a lot of talking to our people, and with also what is happening now that the third wave is almost here and a lot of people are getting infected, a lot of people are already asking for these vaccines. They've been bombarding me with question when can they receive their own doses. So we continue to do this communication, but seriously, there has been vaccine hesitancy. I hope and pray we will overcome it. Thank you.
We'd like to thank you, Dr. Mohammed Kawu, is the Acting Secretary, Health and Human Services Secretariat with the FCT. Thank you for joining us on the program.
Thank you so much. I appreciate it.
Medical experts at a conference organized by the National Postgraduate Medical College of Nigeria have called for more investments towards strengthening the nation's public health system to tackle COVID-19 and other future public health challenges. The medical experts, including the Deputy Governor of Kaduna State, believes that the outbreak of the SARS-CoV-2 virus exposed the weakness of the nation's health system, hence the need to improve the sector.
It's an annual lecture organized by the Faculty of Public Health and Community Medicine of the National Postgraduate Medical College of Nigeria. The gathering is aimed at exploring the impact of the COVID-19 pandemic on communities and the need for investments in the public health system.
The state government has prioritized investment in the health sector and has consistently sustained a budgetary allocation of 16% and above for the sector since 2016. This is because we believe investment in a state or nation's public health sector will make for resilience with improved capacity to deliver quality service to populations.
Every part of the world has been challenged by the COVID pandemic, and this pandemic is not yet abating. The only way we can reduce or mitigate the cost is to prepare ahead of these pandemics.
Beyond the vaccination exercise against COVID-19, participants here advocate the sustenance of non-pharmaceutical measures to curtail the spread of the virus.
Although we have done very well with COVID, it is still there. As we all know, there's a threat of the Delta variant. We've started seeing cases go up, which means that these non-pharmaceutical measures, this physical distancing, avoiding crowds, hand hygiene, wearing a mask is more and more important at this time.
It is here with us, and we don't know how long it's going to be with us. And the earlier we adhere to all these preventive, non-pharmaceutical preventive measures, the better for us to build a herd immunity. We had immunizations. I have had my first and second dose of immunizations of COVID. And still we are all in the pursuit of ensuring that we build the herd immunity by these important factors.
Going out of this event, one thing resonates in this meeting, which is the need for a better and improved public health system.
Still to come on the program, the federal government to reflate the economy due to the impact of the coronavirus that's happening in Nigeria. We have more when we return. Please stay with us. Welcome back. The Minister of Finance has been speaking of government's intervention to reflate the economy following the impact of the coronavirus pandemic. Speaking at a meeting in Abuja, Mrs. Ahmed explains that part of the plan is the introduction of the 2021 Finance Act, which targets a reduction in the cost of governance, improving human capital development and enhancing revenue generation. She further adds that other interventions by government include tax exemptions for owners of small businesses, as well as an aggressive revenue generation drive.
Government will also continue to make critical investments in sectors including agriculture, infrastructure, health, and education. To do so, we must sustainably address the long-standing challenge of domestic revenue mobilization. We have been doing this in part through the continuous implementation of the Strategic Revenue Growth Initiative and also through the continued incremental fiscal reforms via the instruments of the Finance Acts. We have so far done Finance Acts 2019 and 2020, and we're currently working on Finance Act 2021. These acts are also working to reduce the cost of governance on a broad basis. We're also working very collaboratively across ministries, departments, and agencies, and with the states and local governments to address financing for cross-cutting issues. This includes working to significantly reduce poverty and harness our demographic dividend to achieve sustainable and inclusive growth, personally through job creation, by enabling the private sector and prioritizing human capital development.
Away from Nigeria, Malaysia's daily number of new COVID-19 cases rose to almost 20,000 today from 17,236 yesterday, as the nation saw more infected individuals in places including Selangor, Kuala Lumpur and Johor. The daily number of pandemic-linked deaths, however, fell to 201, while a rare occurrence of zero imported infections was registered today. Health Director General Tan Sri Abdullahi said in an update via Facebook that this brought the country's cumulative number of infections to 1.3 million so far. Well, Dr. Chan Chi Kun is a retired professor from University Sains Malaysia in Selangor, now based in Kuala Lumpur. He joins us now virtually. Thank you for joining us on the program.
Thank you. Good evening.
Good evening. COVID-19 infections have surged in Malaysia in recent weeks. From the figures, the third wave appears to be more daunting. Tell us about the containment measures being taken by the Malaysian government to slow the spread.
Well, the most current steps which have been introduced have been instructions for home quarantine for individuals who are suspected or have been tested positive with SARS-CoV-2. So this would include asymptomatic cases as well as those showing mild symptoms. So this would be home quarantine.
Malaysia also closed its international border entry points, and this is except for foreigners leaving the country and for Malaysians returning from overseas. Tell us about travel migration restrictions in place.
At the moment, for arrivals who are fully vaccinated, they're also allowed to do home quarantine and self-observation. As for departures from Malaysia, I think the issue is more the receiving country, because Malaysia is in a rather bad state now. So I suspect there might be some countries some rather wary about receiving arrivals from Malaysia.
You also talked about the quarantine measures. I mean, part of that is the virtual assessment centers. Tell us a bit more about this.
Yes, this is elaboration of my first response again. As I mentioned, the home quarantine would apply to individuals who are suspected or have been tested positive and are either symptomatic or showing mild symptoms. So this virtual COVID assessment centers, those under home quarantine would be instructed to contact the COVID assessment centers in the event they manifested a variety of symptoms. There's a list of about a dozen symptoms like cough, oxygen saturation, discoloration of lips, face. The example of the symptoms, they are advised to be alert to.
Also, Malaysia's decision on Sinovac vaccine raises lots of questions. What's your take on the shot's efficacy against the new and more transmissible variant?
At the moment, 3 vaccines have been approved by the National Pharmaceutical Regulatory Authority. That's Pfizer, AstraZeneca, and Sinovac. At the moment, those approvals are still valid, and the Ministry of Health is closely monitoring the performance of these vaccines, in particular against the more severe outcomes, severe illness, hospitalization, and deaths. So far, the ministry is fairly comfortable with the significant efficacy against this more severe outcomes.
Malaysia has also been ramping up its vaccination program, and this is also to bring the outbreak under control. And you mentioned the types of vaccines so far, but in terms of the speed, how fast is it getting to Malaysians, and are they receptive to the vaccines?
Yes, there is some degree of vaccine hesitancy, but it's not a severely crippling situation, for the vaccination rollout. As of now, a total of, Malaysian population is about 32 million, and then there are about anywhere between 2 to 4 million migrant workers, counting both documented as well as undocumented migrant workers. So as of now, total of about 25 million doses of vaccines have been administered through the National Immunization Program. And this includes a total of 16 million individuals who have received the first dose and another 9 million who have received the second dose. The intention is that by the end of October, close to 80% of adults should have been vaccinated, fully vaccinated by then.
All right, well, what
as of now,
As of now, all right. Thank you so much for that update. We hope Malaysia and other countries around the world can indeed surmount this. Thank you so much, Dr. Chan Chi Kun, a retired professor from University Sains Malaysia. Thank you for joining us on the program.
Welcome. Thanks. My pleasure. Yeah.
Kenyan civil servants have been given 13 days to be vaccinated against COVID or face unspecified disciplinary measures. In a memo, the head of public service said the decision was as a result of the low uptake of COVID-19 vaccines among public servants, especially teachers and those in the security sector. Some public servants had deliberately avoided getting vaccinated in order to stay away from work, a trend that was affecting the delivery of services. Well, on Monday, Kenya reported 745 new coronavirus cases, raising the number of confirmed cases to over 200 million. Well, here's more on the global update.
Bangladesh has started vaccinating thousands of Rohingya Muslims in the world's largest refugee settlement amid a surge in COVID-19 infections in the country. Around 48,000 Rohingya, aged 55 and above, will be inoculated between Tuesday and Thursday with the help of the United Nations. Over in the United States, hospitals are filling up rapidly as the Delta variant sends COVID-19 cases surging to a 6-month high. The U.S. has averaged 100,000 cases for 3 days in a row, up 35% over the past week. Meanwhile, the number of children hospitalized with COVID-19 is also rising across the country, a trend health experts attribute to the Delta variant being more likely to infect children than the original Alpha strain. The trend is particularly acute across parts of the country grappling with low vaccination rates.
So since early July, we've seen a steady increase in the number of cases, and we've also seen an increase in hospitalized children and adolescents as well. It is considered a fourth wave here, and it's due to the Delta variant, plain and simple. The Delta variant is the most contagious variant of COVID yet known.
New South Wales authorities have vowed to crank up policing of lockdown rules in Sydney. It comes after the city reported its biggest single-day new COVID-19 case number yet, with more than 5 million residents of Australia's biggest city now in lockdown for more than 6 weeks. Sydney reported 343 new infections over the past 24 hours. Topping the last one-day peak set on Saturday, there were also 3 deaths from the virus, all of them unvaccinated.
But we also have to accept that part of the challenge we have in New South Wales is because of lack of compliance. Part of the challenge is just because Delta is very, very different to anything we've seen before. And part of the challenge is, of course, having people accept, a small handful of people accept that this is serious. Unfortunately, there are still pockets of people who think that this is not a serious illness, who don't believe that they need to follow the health orders, and that impacts everybody. But moreover than anything else, it's the way this virus spreads and the way the virus moves.
And finally, protesters have clashed with riot police in Bangkok after Thai authorities detained 11 leaders of the demonstration against the government's handling of the coronavirus pandemic. Thailand's youth-led protest movement has been regaining momentum amid growing public anger about Prime Minister Prayut Chan-o-cha's handling of the country's worst wave of COVID-19 infections, and with the economy taking a new battering. Hospitals have been pushed to the brink by the latest wave of cases, and Thailand reported a record COVID-19 death toll of 235 over the past 24 hours.
Continue to take responsibility. You can visit our websites for more updates, also a better understanding of the pandemic. You can find breaking stories as well. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Nwaka. Stay healthy.